So the biggest thing that nursing schools actually try to teach you, friends, is this. Abnormal versus normal. That's it. That is it. This is what nursing schools spend 2.5 years teaching you. Because let me explain. As a nurse, it doesn't matter where it is that you work. There's doctors, there's nurses, there's other healthcare staff, right? Everybody has their role. Doctors diagnose. Doctors will diagnose and treat. As nursing staff, yes, we have nursing diagnosis. Yes, we have protocols to treat. But at the end of the day, friends, when it really comes down to the root of our role is to identify normal versus abnormal. And that's the biggest thing to take away. It doesn't matter where you are in the nursing field, profession. It's like the biggest thing to understand because it'll help you a lot along the way. If you're in a hospital and you need to assess a patient, the first thing you want to recognize, is he normal or abnormal? Where is the abnormality here? If they come in with this complaint, where is the abnormality? And I'll explain some of just the very superficial things to look for, but in general, as a nurse, you're going to be trained in school to just recognize what normal is. That way, when you see something that is abnormal, you're like, oh, that's abnormal. Let me bring it up to the doctor. Let me make an intervention here. And it'll suit you in the healthcare field. It'll suit you in your day-to-day life when you're around family and your friends and just in your personal life experiences. It's a very foundational root thing that you learn as a nurse. And just being able to identify what normal is. That way you know, hey, that isn't normal. And then now, as part of a care team, you bring it up to someone's attention, you communicate it well, and now this patient can receive treatment, and then you engage in interventions and things like that. Like, that is just it. That's just a very simplified way that I think nursing schools spend 2.5 years to teach you, but it really takes that long. It does take that long to understand, and I'll explain. So just looking at it a bit further, like what's normal? So textbook will always say, 120/80, blood pressure, pulse will be like 60 to 100, pulse ox or oxygen saturation, you could be 93% or higher, right? Respirations, anywhere from like 16 to 20, temperature, it could be like 98 Fahrenheit. And it's just somewhere around there, right? Like, this is normal. Other things that you look for physically, so one thing you look for is gait, right? You can look for wounds. This is all surface level, superficial stuff. This is all physiologically, something may be wrong, right? So if something's off with the blood pressure, there might be something wrong. You might want to take a look at that. Knowing pathophysiology, it could be cardiac related, renal related. There's other ways to look at it. Pulse will also paint a picture, right? If your pulse is elevated, did they work out? Did they drink caffeine? Or did they just sit there in the waiting room and their pulse is still really high? That could be a red flag. If something's off here, right, with their oxygen saturation, maybe they have COPD, maybe they don't. Maybe they're in acute respiratory distress. And then the respirations, right? Why is it 26? Temperature, why is it elevated? Do they have an infection or something, right? Why is it low? Are they septic? These are all things that this nursing school will spend, 2.5 years teaching you to view as a general picture. That way, when you're out in the field working as a nurse, you will be able to pick it up and be like, oh, this isn't normal, that's normal. There's so many times in my nursing career thus far where I'm just like, I take someone's vitals and I'm like, oh, you're fine. This, and it takes a load off, right? When a patient comes in for something and you take their nice vitals and they're all good, you're like, okay, like I know something may be wrong with you, don't get me wrong. But as a nurse, I'm like, okay, I can kind of relax a little bit and take this as it comes. As opposed to taking someone's vitals and seeing like a blood pressure of like 190/110, right? And you're like, ooh, okay, we got to do a little bit something more urgently here. Let me go get the doctor. Let me go relay this message. But that's pretty much it, friends. Abnormal versus normal. Anything within this, normal. Check for physical stuff, surface level things. You know what normal and abnormal is there. But just in generality, friends, recognize what normal is. And nursing school is going to spend 2.5 years teaching you what normal is, what normal can be in different scenarios. And then you'll be off on your own. See you on the next one, friends. Hopefully some of this was helpful.